Are you a chiropractor, physiotherapist, or osteopath, and ever wondered why some patients in your office, after each session or sometimes certain sessions, develop fatigue, soreness, the muscles and joints, they get lightheaded, sometimes they get nauseous, and sometimes even develop headaches? Have you ever wondered the reasons why this occurs? And sometimes this can occur irrespective of the type of treatment that you provide, whether it be instrument assisted, exercise, manipulation, adjustments, taping. Patients still complain of these things, and they say to you, "Doc, why am I experiencing this?" And you may give some excuse, but it may not be enough that the patient stays in your office, and unfortunately they may leave. Okay. Hopefully, if this has happened, well, not that I hope it has happened, but I know that it has happened for just about every practitioner. I've been in practice now for 20 years. I don't know, it happened for some years until I understood the reasons why. And the reasons why is we're going to talk about today. All right. So allow me to introduce NeuroConnect. NeuroConnect is a 4-part module series that we're going to be kicking off in Hong Kong starting March 2019. It's a 4-part series that covers and condenses a lot of information that I have into 4 very applicable modules. Module 1 is all about understanding the connections, all about understanding why things happen and how things are connected. Module 2 is about putting that together into assessment. How is it with the knowledge that you have? What can you do to assess someone effectively? Modules 3 and 4 are about the most common conditions that you're likely to see in your office. Okay. So today I want to talk about the autonomic nervous system, because it's the autonomic nervous system that helps us understand why some patients respond in a negative way than we would prefer them to. Okay. The autonomic nervous system is beautiful. It's beautiful to understand, and we need to move away from a very textbook model of understanding, the sympathetic and the parasympathetic. The question is how does it relate to the spine? How does it relate to what we do? What you need to understand is the autonomic nervous system is hardwired to the spine. Hardwired from a very early embryological step. Because understand, every time I move my arm or turn my head, there needs to be an assurance that there's fuel supply, oxygen and blood supply to my body as I grab something. It's not purely the volitional act of doing something, but I need to make sure there's blood supply to my arm so I can pick something up and hold it accurately. If not, I may drop something or may be ineffective and may injure my arm or my shoulder in that way. So understanding that connection between the autonomics and the spine and the body is really important. It's not just about, we see this when someone does a movement, they get flushed, they may get sweating, they may get lightheaded, they may get anxious in doing something. A lot of this has got to do with that connection between the spine and the autonomic nervous system. And as practitioners, we need to know this. We need to understand that how much or how little treatment do I need to provide to that person to make sure that we're within their threshold. Because if we don't, and we just go all for it, and we think we're doing the right thing, but all of a sudden they say to you, "Doc, what you did yesterday or last week, I was sick for about 3 days after it. I was nauseous, I was headachy, I was achy, I couldn't function." That means that we probably exceeded their capacity. And understanding that's really important. All right. So without this, you're not going to be able to assess someone or apply therapy effectively. All right. Details of our seminar are as such. The seminar is going to be held in a rehab center that we presented earlier this year in August. It's a great center. It has multiple rooms that you guys can do your practicals. It has equipment that we can do both assessment, and you'll learn some of the cutting edge technology to apply in your office. The issue is that it's only limited to 20 people. I can't have more than 20 people here. I want to be able to give you guys a very tailored, personable experience, and that will only happen with small numbers. So get in now. We've got very early bird prices that exist to the end of this year. After that, prices go up. All right. We also got some great specials on if you were to secure all 4 modules at once. Again, take advantage of some of these specials. www.brainhubacademia.com.au. I look forward to seeing you then. Bye for now.